Thank you, Dr. Hatem. Thank you, Dr. Siham. Thank you, Dr. Mohammed, for your invite. It's an honor to be presenting amongst my professors and my colleagues. It's an interesting case that I met in our dry eye clinic. It's a 36-year-old male. He was not complaining of anything, just ocular discomfort for 10 days that was not improving with any treatment. He did not have any surgery or any history of disease. He was being treated by 2 different consultants and with no improvement. So he sent me this picture on WhatsApp. I hate, as we all do, online consults because you don't get to experience the slit lamp examination, so I can actually misdiagnose it. So this patient looks like a typical case of blepharitis, maybe seborrheic blepharitis. As you can see, you can easily mistake it for it. So I don't blame the doctors that have missed this. So next day I told him to come in for a clinical examination on the slit lamp, and what I saw was severe hyperemia of the lid margins and small petechiae-like hemorrhages that I hadn't seen before around the lashes, and multiple scratches from severe itching of those eyelids, and this. As you can see, this is the organism I saw the next day. This is lice, pubic lice specifically. How do I know it's pubic lice? Because it's very rare for head lice to attach to the eyelashes. I don't know what's the explanation for it. Maybe anyone who knows can help. But this is the difference between the pubic lice and the head lice. The pubic lice is more crab-like. It's more rounded. The body lice is more longer. It's a bit long. In high magnification, you can even appreciate the blood circulation going through the lice itself. Moving. This is a very rare video to actually see the blood meal itself, like the lice itself feeding from the penetration of the roots of the lashes and feeding. And these, as you can see, are the nits or the eggs of the lice. The idea is to familiarize yourself with this picture so you don't miss it, because just missing it for 1 week allows, because the adult lays like maybe 7 to 10 eggs, and it keeps on, the life cycle keeps on going if you don't pick it up in the first 7 days. So this is, again, another shot of the blood circulation. You will see it feeding. These are blood meals. It eats about 5 blood meals per day, and it keeps getting out these dot hemorrhages on the lashes that we will see in the next pictures. You see the end, it's coming out, the blood is coming out, and you can notice these, it looks like a petechial hemorrhages, but it's actually the blood meals being digested by the lice itself. And this is what causes the irritation, just like a mosquito bite. It embeds, it suckers into the roots of the lashes and inflames the eyelids, so it causes severe itching and swelling and redness. It cannot live more than 24 to 48 hours away from the host. So, and it lays like 3 nits per day and hatches maybe 7 to 10 days later. So you actually need to diagnose it really early to treat it. If you try to pick it, which it's a mistake I did, I tried picking it while it's still alive. It's very deeply embedded and it's very painful for the patient. Thank God this video is without sound, because you would have heard the patient screaming. But it's very adherent to the roots of the lashes. As you can see, I'm trying to pick it with a colibri forceps, and it's extremely adherent and embedding its suckers deeply into the eyelid margin. This is another video of the clear nits. You can see them. These are the small crabs inside the nits. So what to do next? You have to revisit the history, because the history, how did it start? Did he self-infect himself from his pubic hairs to his eyelashes, maybe by scratching, or is it by sexual intercourse? You can know, because usually if it's from sexual intercourse, it goes from his eyelashes to his pubic hairs, which happened with this patient. And re-examine the complaint. It explains the night itching. He mainly complained of severe night itching, mainly at night. So as you know, these organisms, they tend to be active more at night and cause this severe night itching. And you have to ask the awkward questions about sexual intercourse and the hygiene, because you have to inform the sexual partners of this patient about these lice infestations. And in children also, you have to be very aware that this might be the only sign of sexual abuse. So keep this in mind if you see it in a child. So the management is pilocarpine is suggested, but we can't even find it for glaucoma patients, so I couldn't find it. Yellow mercuric oxide, which is a very old treatment that, again, I couldn't find. And ivermectin didn't work with this patient. I tried it. The best option was to cut the lashes from the roots, but the patient refused. So the other option is to suffocate the louse and then pick them one by one. How do you suffocate it mechanically? By either petroleum jelly ointments or our normal steroid antibiotic combination, and even the steroid will help quieten the allergic reaction a little bit. This is after suffocating them for a couple of days with petroleum jelly and then picking them. Even after they are dead, you can see that they are still hanging in there to the roots of the lashes and not very easily removed. So finally, it comes out. You have to pick them one by one if you're not going to cut the lashes, and you have to make sure that you get all the eggs and the nits out. So looking back at these photos now and zooming in, you can actually see them grossly from the normal pictures, but you have to know what you're looking for and where to look. So the take-home message, always focus on the complaint of the patient because it has the clues if it's misdiagnosed. No teleconsultations in our specialty because they don't work. And don't be fooled by the socioeconomic standards of the patient in these cases at least, because this was a patient that should have been in a hygiene level that shouldn't allow for this to happen. And don't shy away from asking the awkward question about the sexual intercourse and the sexual abuse in young patients. Thank you very much.